Looking for signs of liver cancer in women? The liver, a vital organ, processes nutrients and eliminates toxins. Though rare, liver cancer often progresses silently, with symptoms appearing late. Recognizing early signs is crucial for timely treatment. Let's delve into silent symptoms and prevention methods. Signs and symptoms of liver cancer in females. Symptoms of liver cancer don't usually appear until the illness has progressed to an advanced stage. Liver cancer symptoms in females and males are listed below. 1. Pain and swelling in the abdomen. The unusual pain and swelling in the abdomen indicate liver cancer. Experts stated that people feel frequent pain when examining patients with liver cancer and pressing a specific area. The inflammation and pain can also cause liver infection or abdomen infection, and you must hear the voice of the body. 2. Sudden weight loss or weight gain. A disease called liver cirrhosis that affects the liver slowly kills healthy liver cells and interrupts blood circulation, and can cause sudden weight gain. Like any other type of cancer, if you lose weight without making any effort and feel weak and pain on the right side of the ribs, you must contact the doctor immediately. 3. Lack of appetite. Whenever you get affected by any disease, especially any type of cancer, you lose appetite. In the case of liver cancer, excess fluid fills in the abdomen, and you hardly feel hunger. You may feel bloating, nausea, burping, and heaviness in the abdomen. You may feel irregular bowel activity. Like in pancreas cancer, diarrhea is a common sign. Hence, these all signs relate to other physical issues, but you must ask for a diagnosis. 4. The pale color of skin and eyes. If you feel the pale color of your eyes and skin and itching on the skin, it simply indicates jaundice and can be a sign of liver cancer. Though jaundice can occur from viral infection or food poisoning, other cancer types like gallbladder cancer, something wrong with the pancreas, or any other issues. 6. Type 2 diabetes. It has been recorded in people with liver cancer that obesity and type 2 diabetes can increase the chances of liver cancer, and if you have both, you mustn't ignore the regular checkups. Moreover, other causes are available for obesity and are directly not linked with liver cancer, but prevention is always better than delay. People who are non-alcoholic with obesity and diabetes may detect liver cancer, so talk with your doctor today. 7. Feel confusion and fatigue. Any cancer affects the whole body, including our brain, and in the case of liver cancer, you may feel a lack of concentration and forget things in people's faces quickly. You always feel tired and have brain fog and cannot focus properly. However, many other causes can also appear in these signs, so the proper tests should be done. 8. Muscle pain. If you are feeling muscle pain or joint pain without doing a workout, you must notice it. The unusual pain in the different parts of the body is telling something is not right inside. The primary cause of developing liver cancer is hepatitis B and C, which can spread quickly through unprotected sex and contaminated needles, so try to have safe sex and use safe vaccination from a trusted hospital. Always ask your doctor for the vaccination of hepatitis C and B to prevent them from liver diseases and cancer. Avoid excess alcohol consumption and avoid smoking, which can cause liver cirrhosis. Try to maintain your body weight and add a healthy diet to the chart. If you have diabetes, you must keep the blood sugar level as well. Liver cancer can be cured if diagnosed early. If you feel any symptoms or have any family history of liver cancer, you always ask for regular checkups and examinations that can detect cancer.